All right, are we on? All right. Good morning, everyone. Welcome to today's class and lecture. Thank you so much for those who are present. It's nice to see familiar faces. Thank you to those who are watching. I'm sorry for the delay. We had some technical difficulties, but we're glad you're joining us today. It's going to be a very interesting lecture, so sit tight, and I hope you brought some paper and pens to take notes. If not, worst case, you can always go back to our YouTube channel. It's going to be posted there as well, and the YouTube channel name is Elmhurst SDA. So a little bit about who we are, if this is your first time watching. We are the Elmhurst SDA Community Lifestyle Center, and our goal is to nurture the physical, the mental, and the spiritual needs of our community. And so throughout the last few years, we've been hosting cooking classes. We've had some guest speakers come and do some disease prevention seminars. We also offered fellowship, and things have changed a little bit with COVID, but we're hoping to get back to the food festivals we hosted and all these fun events soon. Now, about the speaker, Walt Cross. If you don't know who he is, he's coming to us from all the way from the Smoky Mountains of Tennessee, where he and his family serve in a ministry called the Mustard Seed. And officially, Walt has official education in healthcare administration. He's worked in healthcare for many, many years until he transitioned to a more holistic, proactive approach to prevent disease. And since then, he's been traveling all across the world doing lectures. And so we're really grateful that he's made some time to join us here as well. Before we begin, if I could just ask Pastor John to come up front here for a quick word of prayer to bless this seminar, and then we'll jump right in.
Let us pray. Dear Heavenly Father, you're giving us another beautiful day after the rain, and we are thankful for the sunshine, even if it is cold outside, but you're showing constantly your mercy toward us. And today we are going to learn many things, and we praise your name for that, for the knowledge, for the herbs and different things that you created that they can be for our own healing, Lord. I praise your name for that. Let our minds and hearts will be open, that we can learn and apply those things in our lives so that we can have healthy bodies, because in healthy bodies is healthy spirit. I pray that your mighty hand will protect us, that we can learn those things, that our immune system can be strong, and all to your glory, not to our glory. And above all, let us always give you glory for everything and accept you as our Savior, as one who takes care of us. In the name of Christ I pray. Amen.
Thank you, Pastor John. Now I'm going to invite Walt Cross to come up front and enjoy the seminar. If you have any questions, please take note of them and we'll ask them at the end. We'll have a Q&A. For those watching, you can submit your questions through YouTube. I know we've had some problems with Zoom, so with those watching on Zoom, please head to the YouTube link. Thank you so much.
Good morning, y'all. And good morning, y'all, back home in East Tennessee. I know we had folks Friday and yesterday watching from home back on our website and our Facebook. So howdy, y'all, back in East Tennessee. This is my favorite class. It really is. It's my hardest class, though, because there's so much to do, and I didn't even bring so much today because of flying up here. But it's amazing what natural remedies can do to help our health. And as Anna said, I worked in conventional healthcare for 20 years. And for the majority of that, we masked and managed. We didn't get to root cause. And that is the key here, is getting to the root cause. Let me share a key for y'all before I start. Yes, we may use some turmeric for inflammation or whatever it may be for an acute issue. But the key is 8 laws of health. And we can't ignore those. So let me share those real quickly. The first law is fuel. What are you putting in your body as fuel? Are you putting processed foods? Are you putting food that's just not that healthy? The key is, does the food have the nutrients that it takes to run the cells in the body? And Cornell University and Cambridge University has found the most nutritious food around the world in their research over a 20-year study was a whole food, plant-based diet with variety. Now, plant-based, yeah, Fruit Loops are plant-based, but are Fruit Loops good for us? No, they're not whole food, they're processed. And so you want whole food, which would be like that apple I ate for breakfast, or that pear I had for breakfast. That's whole food. And then plant-based, well, that's just fruits, nuts, grains, and vegetables. Cornell found that when you get in outside of that area, you start seeing more disease. And I totally believe that because I grew up on a dairy farm and then went beef cattle and even into my teens did a lot with beef cattle. And at 16 years old in the stockyard, I gave up eating meat because I saw what we were taking to the stockyard. I saw what other folks were taking to the stockyard, and it just wasn't the healthiest meat. And I quit eating meat at 16. The second key is exercise. Exercise is so important. You've got to have exercise to increase the blood flow, increase the lymphatic flow, and folks just do not exercise like they used to, and exercise is critical for the body to function. The next one is this guy right here. He is so powerful, and that's water. You've got to drink water. And there's several keys to water. You got to have enough water. University of California at Davis found it takes a half a gallon of water to run a 5-year-old. And that's from a 5-year-old all the way up to 128 pounds. And there's several of y'all here that are less than 128 pounds. Even if you're an adult, you need a half a gallon of water. But that's to sit on the couch. If you're exercising, if you're doing a lot more activity, gardening, whatever, it takes more than that half a gallon. But those of us that are over 128 pounds, no, not the super big folks, none of us here are that. There's a special formula for that. But for most folks out there, it's body weight divided by 2, and that's pretty well recognized today. Body weight, whatever you weigh, divided by 2. And those of our listeners that may be listening in other parts of the world, that would be kilograms divided by 30. Kilograms divided by 30, and that's how many liters you would drink a day. But it's not just volume of water. You also want to have, is it quality water? Does it have stuff in it? And so you want to have good, pure water. If you can't, drink water, whatever you can get. But I have some folks say, well, I don't want to drink city water, but I can't afford to get other water. Well, at least drink city water because you got to have water. The other is you want to drink it not all at once. You want to kind of space it throughout the day. If I took it and poured it on a sponge here, and it's going to go onto the sponge, it's going to run out on the table. But every once in a while, if I come by and pour a little bit in there and come back later and pour a little in there, you're going to have more absorption. And there's a key that if you drink too much, more than 3 to 5 ounces, you're going to go into free flow. And what we're seeing is if you will drink just 3-4 good swigs, just 3 or 4 of those every half hour, approximately 4 ounces every half hour, you're going to get really good hydration. The next one is you got to have sunshine. Folks don't get sunshine today. Your vitamin D, the fresh air when you're out there in the sunshine, the colors, and looking at the blue sky and the green grass, and it's very therapeutic. The other one is just making the right decisions. Some people call that temperance, but there's many things that we can make regarding our lifestyle, just making right decisions, whether it's the food that we eat, what we drink, or what we're listening to, or what we're watching, or what we're doing. The other one is fresh air. But it's not just breathing fresh air. Yes, sometimes when I fly into L.A., as I'm coming to L.A., I just go into a smog. And you don't want to breathe that. That's not healthy for us. But it's not just that. It's also having good diaphragmatic breathing, and where you're not breathing like a chihuahua, but you got good diaphragmatic breathing from your stomach. The other one is proper sleep. Are you getting 8 hours sleep at night? We used to think less than 6 hours. Now it's 7 hours, but Harvard's really flirting with really less than 8 hours could be sleep deprivation. And are you having good quality of sleep through the night? Are you waking up multiple times because you got a prostate issue or because you're stressed out about your young'uns or whatever it may be? And the last one is the most powerful. None of this heals. None of this. I mean, as we look here at golden seal, I love golden seal. It's a great herb that God's given us. But this doesn't heal. God's the one that does the healing. And ask God to bless whatever you're doing as you're using these Old Mountain remedies. So those 8 laws are very important. We can't forget them. We can't say, oh, well, I can ignore those 8 laws. But when I have a problem, I can come use some of these as an acute issue. You don't want to do that. You want to follow those 8 laws, good chance you won't have to use these as much. But you may have to sometime. You fall and you get a cut and you've got an infection. Use these guys, but still use those 8 laws of health. Well, the first thing I'd like to start with is herbs. And herbs you can get herbs in different forms. You can get them in a bulk herb like this that you can make a tea out of it, or you can powderize, or you can put it in a capsule. You can use it as a poultice. There's a lot of ways we can use herbs. And we'll talk about these individually. And that's one way we can use it. And then we can make extracts. And an extract is, let's see here, I don't think I brought an extract with me here. An extract is, and we'll talk about how to make an extract this morning, and that's where you make it a little more potent, and it's a little smaller. And the other one is an essential oil. Now, some folks say, oh no, essential oils, those are bad. That's kind of out there stuff. No, it's just an herb. All they've done is they've taken the herb, and I'd say, let's see here. This one here. How many of y'all have used lavender? Any of y'all ever use lavender? How about peppermint essential oil? It's not a problem. All they did is they took the herb in whatever form they had, and they either distilled it or they pressed it. But I call them herbs on steroids. If you had peppermint essential oil, 1 drop of peppermint essential oil, you would have to drink 28 cups of peppermint tea to get the same medicinal benefit as 1 drop of peppermint oil. It's phenomenal, though. They're just so strong. And we'll talk more about essential oils. So let's go ahead and start talking about the herbs. Let me share some of them here. We'll just go from front to back. Chaparral. Who's ever heard of chaparral? What'd you use chaparral for? Okay. Chaparral it's nasty. It really is nasty. It doesn't smell the best, but it tastes really bad. But it's a great blood purifier. It's great. The kids in high school, they'll come to me and they'll get chaparral. I don't encourage them to do the tea because they probably won't drink it, but they'll use capsules, and it's great for acne. My favorite is using it for cancer. If you want to kill cancer, you've got to purify the blood. And this is a tremendous blood purifier. It grows in the high desert of Arizona and California. If you ever go there, you can smell. I mean, let's say this is chaparral bush, you can literally. I mean, I can smell that chaparral from this far away from the bush. It's real strong. But chaparral is just an amazing herb if you're wanting to purify the blood. Elderberries. Who's ever used elderberries? Elderberries are another one. They grow where I live. You can go and pick them. The Old Mountain ladies, they would pick them and make all kinds of stuff with them. You can take them, and I have ladies that come in and they pick the elderberries and they put them in little baggies, put them in the freezer, and when they need to make elderberry tea, they'll pull it out and they'll make a tea. Most of the ladies, we get a lot of ladies that come in, and some of you all may be watching this morning, and they'll buy the elderberries like this, and then they'll make an elderberry extract. And elderberry extract is super, super powerful. And we talked about elderberry on Friday evening, how beneficial it is to viruses. And we'll talk about how to make an extract out of this a little bit later. Golden seal, one of my favorites. Another one that's nasty in taste. Who's ever drank golden seal tea? Nasty, isn't it? In the mouth, that's bad enough, but when you swallow it, it's even worse. The elderberry we use to build the immune system. The golden seal is also good to build the immune system. Now, there's some herbs you have to do your studying, because you're like elderberry, you can use all the time. I take elderberry every day. I'm really feeling vulnerable. I didn't bring it up here. And so it's just amazing how good it helps that immune system stay high. And so you can take it every day of the year. This guy, no. You don't want to go over 2 weeks. Now, I've got a buddy in D.C. He's done research. He's a physician there. And he's found you can use it as much as 30 days if you need to. But it's best about 2 weeks. And so you can pulse it. You can do 2 weeks on, 2 weeks off, 2 weeks on, 2 weeks off. Or if you want to mix it with like elderberry, you can, let's see here, echinacea. You can go 2 weeks golden seal, 2 weeks echinacea, 2 weeks golden seal, 2 weeks echinacea. But you've got to pulse it because it's a natural antibiotic. And so, though others are, some you can take long term, this one you can't. It starts losing its potency. Not that it's going to hurt you, it's just not as strong. And you start losing your potency. It's great for strep. It's amazing for strep. You just take you a little pot, and we'll talk about how to do this. You take a pot and you put in, you put your water in here, bring it to a boil. Once it starts to bubble, plumb means total. Plumb turn it off, and then you can take and get a little jar like this. This is a great jar for doing this. Get a jar like this, put 1 teaspoon in here, pour in 8 ounces of hot water that was just boiling. And what you want to do is let it sit there for at least 30 minutes, and then you can put it in the refrigerator. But what the person does, again with strep throat, is they'll take a little sip and gargle for 2 minutes. They'll take enough to gargle for 2 minutes, and then they'll swallow it. And you do that every 2 hours. 2 things are happening. You're getting the golden seal in the system, systemically, into the blood, and it's going to fight the strep. But also, you've got the little pustules on the throat that you're also topically getting it in, and transdermally it's going in. And so it works very well. Let's say you had an ear infection. Golden seal's amazing. You can take and we'll pretend this is olive oil. So I'll take a teaspoon, and I'll put again, we're pretending this is olive oil, and I'll put it about 70% full of olive oil, and then I'll put enough golden seal in here, which is about a third to a half of a capsule, and you put it in there, and you stir it, and you stir it. You want it as thick as possible, have the highest viscosity as possible, but yet still drips. And then what you do is you take a medicine dropper, or take you a butter knife, and stick it in there, and drop it 3 drops down in the ear. And then you kind of rub it down like you would rubbing something down a dog's ear. Rub it down in there. And then, you know those hot packs that guys wear when they are when they're hunting? Do folks hunting around here? You know those hot packs? You put them in your pocket. You can get them at Walmart. It heats up. You get one of those, and you put it on the ear. And you can put a toboggan or something and hold it on the ear. And every 2 hours, you put 3 drops of this golden seal and olive oil into the ear, and it will every 2 hours. And usually less than 24 hours, the ear infection's gone. If it's a small infant, I'll do 2 drops. If you got a dog with an ear infection, do it to your dog too. Hawthorn berry. Who's ever used hawthorn berry? What's hawthorn berry good for? I think it's great for the heart. Yes, palpitations, increasing that heart muscle, electrical. It's help all the way around. It helps the heart, and so you can make a hawthorn tea out of this, or you can do capsules, or you can do an extract. But hawthorn is your best herb for the heart. It's kind of like if you what's the best lung for the lung? Best herb for the lungs? Mullein. What's the best herb for the liver? Milk thistle. The best herb for the kidneys? We've thrown it away by the truckloads. Corn silk. Corn silk is the best herb for the kidneys. Dandelion is also good for the kidneys and in the liver. This one's nettle, and we'll make some nettle tea out of this. Who's ever used nettle? Stangen nettle? Okay. In our neck of the woods, when you're a kid, if you had run through the woods and with your short pants or no shoes, run through the woods, it'd light your legs up. Does it grow in the Caribbean? Okay, I figured it might. It's an amazing herb. When I go up to like Minnesota and Wisconsin, up next to Canada, I don't know if it grows in Canada or not. Do you know? But I know we're talking just 30 miles from Canada it grows. And the ladies will go out and they'll put gloves on and they'll go pick it. And they will put it in their soups and their stews, and or they'll cook it. Nettle, we're now told, is probably the most nutritious of all the herbs in North America. It's very, very good in just nutrients. It's great for female hormones. That's what we use it most for. One day I was by my herb cabinet. We got an herb cabinet probably, I don't know, it goes from that corner right there to maybe here. And it's pretty big. And this lady comes in, and she works on a dude ranch, or has a dude ranch. And she comes in in her cowgirl outfit. When her husband comes in, he's got spurs and boots and hat, and they're just cowboys and cowgirls. And she comes in, she says, "Walt, I need some more nettle." And so I get down and I look, and my jar's empty. I've got these big jars, it's empty. So I look underneath, and I said, I'm afraid I'm plumb out. And she said, "Walt, you better get it in." She says, "Cotton County's going to make national news again." And I said, "Why?" She says, "As many women as you and Mary Lou have on this stuff, we'll make national news again." It's great for hormones. Super, super good for hormones, for ladies' hormones. It's got a lot of calcium in it. So if you're looking for calcium, it's a great source of calcium. And are you ready for this? Who has ever had an asthma attack? Anybody know what an asthma attack is? In Asia, here's what they do. They would take you, if you're having an asthmatic attack, they would take you and they would strip your clothes off the top. You'd totally be bare. And then they take the stinging nettle and they whoop your chest and they whoop your back. Whoop means whip. And I mean, it lights you up good. It stops the asthmatic attack. Now, once the asthmatic attack is stopped, then they will bury you in clay or put clay all over you, and the clay pulls the stinging out. Isn't that cool? You don't want asthma there. This one's Podiarco. This is probably my favorite for cancer. Who's ever heard of Podiarco? Podiarco is amazing. It comes from the bark of a tree, and Podiarco is very good for prostate. It's probably my favorite to use for prostate issues. It's excellent for shrinking the prostate. But it also, years ago, did you ever see people play Pac-Man? Pac-Man? This is like Pac-Man. It loves to eat cancer. Podiarco just loves to eat cancer. And it's excellent when a person comes to me for cancer, or a person calls me for cancer, this is the first herb I use. Yes, I use ACAC throughout the time, but I'll pulse the herbs. I'll do one let's say I don't start with chaparral, they won't do any more of my herbs. They'll say that's all nasty. And so I'll leave that one down the road. But I'll start with the Podiarco, and then maybe I'll use burdock root, and maybe calendula, and then see if I can get them to drink the chaparral. But Podiarco is just phenomenal on fighting cancer. Again, it's really interesting. I said this was good for blood purification, right? This one's good for blood purification. If you look at your herbs that purify the blood, there's a high probability it also kills cancer. I was doing something for these guys. No, actually, it was this one here, for Amazing Discoveries. And I was going through just doing a lot of herbs, and really studying the properties of them. And as I was identifying what the properties were, everyone that said blood purifier, it also killed cancer. Blood purifier killed cancer. That's very interesting. But Podiarco is good. You can do it as a tea. You can do it as an extract. You can also do it as a capsule. This is psyllium husk powder. Psyllium, I I'll use it in making a poultice. We're going to make a charcoal poultice. If I make a herbal poultice, let's say we've got a person that has cancer, and let's say we have the chaparral. And so we're on the week that we're doing chaparral. We got breast cancer. Then I'll take the herb, the material, and we'll show you how to make a tea. I'll take that plant material that's left over, and I'll take it, and I want to make a hamburger patty out of it. And then I'll add a little, where is it here? The psyllium husk. And there's psyllium whole and there's psyllium powder. You want the powder. And so I'll put a little powder in there, about a half a teaspoon, and I'll mix it in there. If I need a little more water, a little moist, then I'll pour some of that chaparral tea or whatever that tea is. Poke. Y'all know what poke is? Poke is very, very powerful for killing cancer, but you know what you're doing because it can be poisonous. And so I'll make the hamburger patty. I'll put a little of the tea there, or whatever tea it is, and it makes just like a little nice hamburger patty, and then apply it to wherever that cancer area is over top of that, and that's how you make a herbal poultice. And so it works good. Who knows what thicket is? Thicket for a patient that has dysphagia, swallowing problems. If you don't have thicket or something, water is probably the easiest thing to get choked on. As you speak to speech therapists, it's very prone to choke. And so if you need to thicken it up, put you a little psyllium powder in there, and it will thicken it up where they have less propensity to choke on that. Works real good. Skullcap. Who's ever done skullcap? Skullcap is my favorite for depression. A good friend of mine, Dr. Walter Strachan, he was a psychiatrist at Loma Linda. He, the last 14 years of his career, he said he didn't use one pharmaceutical as a psychiatrist. As I would work with him and call him, and he taught me a lot of information. And for depression, he said, Walt, give them skullcap tea. And I said, Dr. Strachan, how much? He said, make it as thick as mud if they can drink it. He said, the thicker it is, the stronger it is, the better. It won't be a problem. And it works extremely, extremely good for depression. I was at the hospital last year with a friend of mine who has cancer. It was extreme amount of pain. And they just could not kill the pain, just could not get rid of the pain. And the physician came in and he says, let me try another drug, and gave her another drug. And boom, it really made a difference. And I asked him when he came back in later, I said, what was that drug? He said it was a Nervine. I thought, So I went back and I've used for pain, I didn't bring it with me, it's wild lettuce. If you want to kill pain, wild lettuce is amazing painkiller. Take a quart of water, bring it to a boil, put 1 cup of the herb in there, and let it sit overnight, and drink 1 cup every 2 hours. If that works, go every 3 hours, go to least dosing. Well, it's worked great, and wild lettuce has no problem on long-term utilization, no problem with contraindication with any other herbs or medication, and there's no challenges physiologically in long-term utilization, so it's extremely safe. I started adding a cup of skullcap to it as a nerving, and it's amazing. It works even better as a painkiller, but I also like it for depression. Slippery elm. Slippery elm. Have you ever seen slippery elm lozenges? If you have a sore throat? If you have a sore throat, my number one go-to on a sore throat is take your water bottle. Take your water bottle and put a teaspoon of slippery elm in here. Shake it up and sip on it. And that slippery elm is amazing, healing your throat, that tissue. I use it for problems with the stomach. I use it for problems with the intestines, colitis, Crohn's, all those guys. Anything from the mouth to the rectum. This heals the tissue extremely well. I'm only giving you just a couple examples today. It's not at all inclusive. These do many, many more things. I just don't have time to cover them all today. Who's ever had stevia? Now, just raw stevia. Now, let's look here. We've got enough. Anna, can you help me? Okay, what I want to do is give everybody a sample. Now, it doesn't take much. That's all they need. Great. There you go. Stevia is just super sweet. And probably most of y'all have had stevia before while, you put in things it's white in color or it's liquid. That's okay, but this is great. Who knows Melody Prettyman or Cavanis now? Anybody know Melody? Melody's a good friend of ours, and she came. Oh, yeah, I do. Let's see. Let's do that much. And so Melody came by the store one day, and Melody's from Texas, and we were talking about sweet tea. Y'all know what sweet tea is? Sweet tea. And if you make a gallon of sweet tea, you're going to put probably 2 cups of sugar in there. 2 cups of sugar. And Melody was talking about, I really miss drinking sweet tea because that's just what Southern folks do. I said, Melody, I think we can do it. So I said, try this out. So you take your quart of water, again, bring it to a boil. You're making an infusion, and put you a heaping teaspoon of this right here, stevia leaf. Put that in there and just sit it overnight. Or you could sit it out during the daytime like you're making sun tea. And then strain it out. You got sweet tea. It has a 0 glycemic index. Type 1 diabetic can drink it. It's not a problem at all. Or if you're wanting to, let's say you don't like the taste of these herbs, you can put, per quart, I usually put about a half a teaspoon of stevia leaf in there. And it will sweeten it up. Now, you can put honey. You can put, different things. But the stevia is just amazing for sweetening up. Turmeric. Who's ever used turmeric before? All right. Turmeric is a great what? Anti-inflammatory. We see the curcumin out there today. Now, curcumin is where they've isolated the curcumin out of the turmeric that is the anti-inflammatory component. There's a product out there I learned from Dr. Agatha Thrash. It's called Curcumin. It has curcumin in curcumin. It also has boswellia. Now, what's boswellia? Frankincense. It's a tremendous painkiller. If you're looking for an OTC painkiller, curcumin is excellent. It will take 500 capsules of this right here. Now, 3 capsules equals a teaspoon, so it tells you how much of this it would take. 500 capsules of turmeric to equal 1 capsule of curcumin. It's just isolated that curcumin component. And so curcumin, there's other companies that carry it. Just take a little, take a little taste of it and see what you think. All right. Thank you, man. Is it sweet? Yeah. Maybe you can get the camera to get an expression of these folks as they try it. Just take a little taste, put it in your mouth like you're, eating grass or something. Is it sweet? Yeah. Yes. It has an aftertaste to it. Yes. This doesn't have the aftertaste. What do y'all think? I wish I could let y'all out there in Cyberland taste it. What do you think, y'all? Pardon? Slightly? Okay. Yeah. Oh, did you get one? Did anybody not get one? Did he get one here? Do we need some more? Okay, we need a couple more. Okay. So that's a natural sweetener that doesn't have sugar. And again, it's a 0 glycemic index. 0 glycemic index. So a type 1 diabetic, a type 2 diabetic, it's not going to affect their glucose at all. Okay, now I need y'all's help. come on up. I've got 2 volunteers here. They're going to help me out. We're going to do a facial. We'll come up. Well, I'll tell you what, if we come over here, because I'm kind of finished over here right now. We're going to do a facial. We've got a husband and wife here. And if I'll let you sit, and if you can sit here. And what we're going to do is now have y'all already had breakfast? So we're not going to eat between meals, so no licking. This is blackstrap molasses, or some people call it molasses. But blackstrap molasses, who's ever had blackstrap molasses? A lot of nutrition here. If you're ever feeling kind of puny, y'all know what puny is? Not feeling a lot of energy, you can take blackstrap molasses and take you a tablespoon of it, put it in water and drink it, or just plumb take it. But it's excellent for giving you energy. Actually, I just finished a course out of Australia last week, a 3-month course, and the instructor encouraged us to put blackstrap molasses, which is this here. This is exactly what this is. They encouraged us to put blackstrap molasses in every recipe just below taste. Does that make sense? So you put enough in there to just below what you can taste. A lot of potassium. It's an excellent source of potassium, manganese, magnesium, great source of iron, as we'd say iron. It's a great source of iron to get. When I was sick, my metabolism wouldn't. My hemoglobin would not come above 7.1, and I started using a tablespoon of this twice a day. Boom, shot right up. So it works real good. So what we're going to do is we're going to, her whole, from here down to here, you're going to turn it black with blackstrap molasses. There you go. Now, what we may want to do here, Anna, if you can help me, maybe you can make a little bib here for her so she doesn't get it on that blouse. Excellent. Okay, so we're gonna. Have you ever had blackstrap molasses before? No? Okay. Okay. Yes.
Many of these herbs, I don't know how to spell it or I don't know about it. Do you have a book or something that we can get after?
Yes. I can't spell them either. I just spell Southern. So I've got, this is called the Herb Cabinet. It's got much more detail than what we're doing today. And then I've got this one called, this is through Amazing Discoveries that you were mentioning yesterday. That's how Anna found me. And then this one is called Old Mountain Remedies. And it also has a much more complete of what we're doing here than what we're able to do today's time-wise. And so that's that one there. And then there's this one here. This one here covers like 100 different herbs, what the part of the herb is that you use, what's the effect, what's the usage, what's the contraindications, the precautions, goes a lot more into the science part of it. And then there's this one here, which is, just another set of series that you can take a look at. Okay, go ahead. Yeah. It drips a lot, so what do you think? Normally, I will offer everybody this option. And so everybody's painting everybody's faces. But because of the current situation we're in today with COVID, I figured we'll just have husband and wife take care of each other. But it's amazing. People tell me, and I've done it myself, afterwards, and you wash it off, it's smooth. Now, if you want to do even a more in-depth facial, what I'll do is I'll do bentonite clay. Now, every bit of this, you want to get it up into here and plumb get that whole area, just turn it plumb black. What I like doing is take one of these, and then what you'll do is you'll put bentonite clay in here and water. Who's ever done a bentonite clay facial? Yes. Now, if you do it, it works better if you make it the day before. Just some way or another, just the way the chemistry is. It works. Excuse me, y'all. It works better if you make it the day before. When I was at the clinic, we would do treatments, hydrotherapy, massage therapy, and the last day, our patients came from all over the world, Russia, Africa, Asia, everywhere. They always got they could choose their last therapy, whatever they wanted. Now, y'all ladies, you're different than we are. The ladies enjoyed this treatment. Us fellas, the guys didn't want it. But the treatment is they would take they make these big old tub of bentonite clay, and the therapist would take it from here to the toes. And people would sit out and they would just bake in it for about 30 minutes. And then they would wash it off. If you go to South America, if you go to Asia, they actually have clay rooms that people use for therapy. It's very, very effective. And so the ladies, they would want that as their last therapy because they enjoyed it. It just felt so good. So what we do for a facial is we'll do a bentonite clay facial and leave it on for about 30 minutes. Now, what that is going to do is pull out toxins, pull the oils, and just really clean. It's a great facial cleaner, is the bentonite clay. After you're finished, you're going to wash it off real good, and then you use the blackstrap molasses, and that will put those nutrients and hydration back into the facial tissue. How's it feel? If you're looking for a good source of nutrition, like I said, I encourage y'all to look at using blackstrap. We grew up putting it on our biscuits, putting it on our food in the South. You can use sorghum. Sorghum doesn't have as much nutrition. It's a little better in taste, but sorghum also has some good beneficial nutrients. All right, we got her. Okay, if you want to go back to your seats, and then after a little while, we're going to wash it off, and he's going to tell us if it's softer. All right, thank y'all. Okay, good. The next one we're going to do is a charcoal poultice. Who's ever made a charcoal poultice? Charcoal poultices are amazing. Several years ago, Walter and I were at Station 2, and we get toned out to a medical call. EMS is busy, and they could not make it there quickly. And they said it's toned out. Assist EMS individual has a bee sting. And then my phone rings. This thing has been bothering us here. My phone rings, and I pull it out, and it's Karen, the dispatcher. She says, "Walt, where are you?" "I'm at Station 2. She says, "Good, I hope so." She says, "It's so-and-so." And I know the individual, and he's having significant difficulty breathing. And so instead of taking the fire truck, which Walter's grabbing his med bag out of his truck, we were going to take an engine. And then we realized the acuity. We ended up taking his truck, which was a lot faster. And we got there, and his skin was white as this right here. And he was from being passed out, his level of consciousness from being plumb passed out to coming back, and he was ready to fight you. Now this guy's served several tours in Iraq. He's in the guard, and I mean he could hurt you. I mean he was ready to tear whoever up, and then he'd pass out again. His pulse, I believe it was 118 when we got there, and his blood pressure was 70 over 40, low 70s over 40, right at 70 over 40. And I said, "Walter, you take care of his vitals, monitor his trending, and let me see what I can do to help him." And I looked at his wife, and I said, "Do you have any activated charcoal?" She thinks. She goes, "Yeah, I bought it from you 2 years ago." Isn't God good? So they ran and got the charcoal. Unfortunately, the brother-in-law thought charcoal, so he got a charcoal briquette. And we said, "No, not those." charcoal in the bathroom, she says. So he runs in the bathroom, brings out a canister about this big of activated charcoal. Now, this guy is in significant health challenges here because his respirations were sometimes almost a stop. And so I didn't have time to do what I'm going to do today. I just poured it out in my hand, and there was a guy there that had a water bottle. Says, "Can I borrow your water bottle?" And I poured it in my hand, and I moved it around, and someone had some kind of a napkin or something. I said, "Let me see it." And I put it on there, and he was stung right here, and it was one of those white-faced hornets. It was put it here, and then I made another one, and I put it down on his leg. Now, Walter, my son, he's like an old hunting dog. When he's on it, he's on it. And he was just monitoring vitals for trending so that I would know what his situation was. And it was within 2 minutes. I noticed his color coming back, and he seemed to be more alert. And Walter says, "Dad, his pulse is coming down." He checks his blood pressure again. His blood pressure is 90-some over 70-some instead of 70 over 40. And he said, "Dad, he's doing better." And then Walter didn't even notice that I put the charcoal poultice on. And then he saw the charcoal poultices, and he knew why he was getting better. By the time the ambulance got there, by that time, when that happened, ambulance took another 15 minutes to get there. When I called in, I said, "What's my ETA?" 15 minutes. Finally, the ambulance got there. By this time, he's up, talking, whatever. He's not even wanting to go to the hospital. I said, "No, you need to be checked out. That's serious." And so the ambulance put him on the stretcher, took him about halfway from where his house is to the hospital. The medic decided this nasty black stuff that was on he didn't want to get yelled at by the ER doc. And so he washed it off, The guy told me within 1 minute, his lips went numb, and he was out that fast. Amazing. And they had to then start giving epi and whatever else. So it's something. My daughter got bit by a brown recluse a number of years ago, and I didn't know what it was. And I was still working in regular health care. It was a Sunday afternoon. She comes up. She has this big old place on her leg. It looked nasty. It was hot. It was red, hard, and it just the wound looked terrible. And I don't know how long prior to it had happened. She came up and showed it to me. So I took her to my neighbor, an old retired doc. And how's it feel? Is it tightening? Okay. And I took her to him, and we went to his house, and he looked at it, assessed it, and I said, "Doc Mundy, what is it?" He goes, "Virginia, get me a charcoal poultice." I said, "Doc, what is it?" He wouldn't tell me because he knew I would take her to the ED, and they would cut that area out. So he wouldn't tell me what it was. He put a charcoal poultice on it, and he told me, he said, "Come back tomorrow night." Now, I would change it more rapidly today. He just did it for 24 hours. He said, "Come back tomorrow night. Let's see how it is." So Monday, I went to work, left, came home. Good time to go back took her to Dr. Mundy's. Took it off. The hardness was gone. The redness was gone. The hardness, the red, the heat, all were gone. And it looked so much better. I said, "Okay, what was it?" He goes, "Oh, it was a brown recluse bite." She has no scar. None, period. And we've helped so many folks that have come in with recluse bites and other types of bites, and the charcoal poultice works well on that. Now, there is a key on charcoal poultices. Let's say you have a boil. Y'all know what a boil. Y'all know what a boil is. Okay, we call it a boil. Who's ever had a boil? Anybody? Painful. If you put a charcoal poultice on it, if you want it to come to a head faster, just put you some tea tree oil on it. And tea tree oil will make it come to a head faster. As long as it is not an open wound, you can put the poultice right up against it, and it's fine. But if you have an open wound, like a boil or her leg that had the open wound from the recluse bite, you want to put a barrier, say a paper towel, or when I went to I don't see our folks from Colombia here. I was in Venezuela, and they don't have paper towels. I mean, those poor people, they didn't even have toilet. If they had toilet paper, but you only allowed 2 squares, whatever you needed it for, you had 2 squares. That was it. So they don't have the luxuries of paper towels and cellophane, you know. So they will use a sheet and just reuse that sheet over and over and over again. But you want to put a barrier in between, and that will prevent it from tattooing. A charcoal poultice can tattoo the whatever you have open wound there. So let's make I tell you what I need. Can you get me a pitcher of water? And let's see, this is a half a cup. Do you have a cup measuring? Okay. So what I use is, now you can use the charcoal, and for years, well, the first time I ever used it, I got stung one time by, and I wasn't all into this. Mary Lou's the one that got into this a whole lot faster than I did. I was out mowing the yard one Sunday, and I got stung by 30-some, I don't remember how many, it was 30-some yellow jackets. And literally, I was just shaking. And so I was laying on the couch, and she'd read something in some book, I don't know where she got it, about charcoal poultices. I didn't even know about charcoal poultices. And thank you, ma'am. And a big, yep, here we go, this worked. And so she went and just put it with water, and she put it on all 30-some stings. I quit shaking. Everything was fine. I went to sleep. I woke up shaking again. And she came and she assessed what's different. The charcoal dried out. So she remoistened it, rehydrated it, and then I quit shaking again. So when you make a charcoal poultice, you want to make sure it stays hydrated. It won't draw unless it's hydrated. And also, it's super messy. So we then learned to use ground psyllium. You can take flaxseed and grind it in a coffee grinder and mix it and then pour your water. But then it's still a bit messy. So I hired this guy out of Switzerland as a therapist, and he came and worked for us, and he made it with psyllium powder. There's psyllium husk whole, and then there's psyllium powder. Now, psyllium husk whole is what I use in my colon formula to help with, stomach and colon issues. But the powder is what you want in making a charcoal poultice. And the more powderized it is, the nicer of a poultice it makes. Now, this is a key. Do not miss this key. I have been busy at work. Someone needs a poultice. I run in, put it in here, pour in my water, and I have to throw it away because it will not work this way. Notice, if you can show them here, see how the color is? You've got your brown and you've got your black. You want it where you can't tell two different colors. So you have to mix it thoroughly. You don't want to see the black. You want it turning gray, because what happens is the psyllium will congeal and the charcoal will just be messy. So you just have to keep going all over it. It takes a few moments. So I do 1 part charcoal, 1 part psyllium powder, 1 part charcoal, 1 part psyllium powder, mix thoroughly, and that'll be about good right there. And between 5 to 6 parts water. Now I used a half a cup. So how much water do I need? 3 cups. So this psyllium works best at 6 parts, and it varies based on the psyllium you have. So I'm going to now here's another key, is you want to be fast. You don't want to pour it in, go back over, sink, get another one, because it's going to congeal pretty fast, but we can do it here fast enough. Sometimes I'll just put it in one container and pour it. There's 1, 2, 3. And you're going to think, well, you're plumb crazy. Look at that. Look at all that water there. But watch what happens. It's amazing. Noticing what's happening? I don't know if you can see here or not. Can you see it starting to get thicker? Oh, I have charcoal all over me. Be careful of the charcoal. Charcoal can stain. It's amazing how many people come and get these. Whether it's gout, their foot's hurting really bad, and we use it for aggressively for a gout issue. We use it for a bee sting. We use it for pink eye, or infection in the eye. I personally like pink eye and eye infection. I'd rather use the golden seal. Works very, very well. But some people like using this, and this works good. They got a boil. It's a little dry. This one's a little drier than normal. Could have used a little bit more water. It's just different depending on which psyllium you have. Okay. I'm going to need your help again, Anna. Let's see here. Let me grab. This is the hardest part of it. Now, what my friend did is he would use Scotch tape, and it works a lot better if you use Scotch tape. I think that's big enough there. Okay, so what we're going to do, this is the tough part. It's so sticky. Okay, if you can grab that, and grab that. Okay, we're going to set it on there. Okay, there we go. Then, you don't have to make it this big. You can make it just one dose, and it'll be fine. And just a teaspoon, 1 teaspoon. Now, here's the problem. one part. How many parts water? 6 parts water. Be careful. You can't heap. You can't heap one heaping teaspoon of charcoal, 1 heaping teaspoon of psyllium, because you can't heap water. And so it's got to be level. Oh, you want to help me here? I told you it's the hardest part. Okay, there you go. Yes. So what happened? Anna has a good question. Can it be put in the fridge? Absolutely. It'll last in the fridge. Who's ever eaten homemade bread? Anybody had homemade bread? What happens to homemade bread if you don't eat it fast enough? It'll mold. Yeah. So this will mold too. The psyllium will mold. Because you got it wet, it will mold. So I'm going to roll it out to about, it's kind of but you can put it in the freezer, and it'll last months, years. Put it in a Ziploc baggie in the freezer, and it'll work fine. Now the neat thing, who's ever made biscuits? Anybody made biscuits? Cookies? Okay, you need some cooking classes. And so, just like you'd make biscuits or cookies, you'll take this and cut off whatever you need for the affected area. Now, when I went to Michigan and worked with this doctor up there, who used it for breast cancer and lung cancer, we used the whole piece, all the way across the lung. And so you will make big ones. Or there's times I'll have a person that has problems that we have to, I'll put this on the whole leg. You can get wider, and so I probably should have gone a smaller batch because I have a wider cellophane at the office, and so it's a little easier. Okay, so now you want to wait probably about 15 minutes. Now, you can use it straight away, but you may want to wait about 15 minutes. It's going to dry a little bit more and be a little less messy. But if you need to use it right away, it's fine. And then I'll take it. It's a little, and there it is. It's ready. So let's say it's ready to use. Have you ever fished in deep sea? No? Have you ever used squid? Who's ever fished with squid? Anybody? That's what squid feels like. So let's say you've got an eye infection. So what you do is you get this thing open if you can. Just like making a biscuit. Or let's say you got a recluse bite. Y'all have brown recluse up here? Y'all have brown recluse? Spiders? Yes? Okay. Okay, all you do, if it's not open, sit it on there. Take you some Saran wrap, put it on top of it, and it's ready to go. Change it as needed. If it's a really bad issue, I'll change it every, at first I'll do it every 15 minutes. On a boil, a number of years ago, I used to have a sebaceous, and I was whipping around the nurse's station, and I cut my corner too short, going too fast, and I bumped the nurse's station, and it burst the sebaceous cyst. And it's painful. Later came a boil. And that was painful. And so I used the charcoal poultice on the boil, and within 15 minutes, the pain significantly diminishes. As the poultice adsorbs, charcoal adsorbs, doesn't absorb. What's the difference? Let's say I have a sponge and there's water on here. It's going to soak up the water. But if I have some flour on here, like this is whole wheat flour, and I've got some flour there, and I have a dry sponge and I go on top of it, it's going to just stick to the outside. That is adsorb. And so charcoal doesn't absorb, it adsorbs. It looks like volcanic rock. It looks like, that's what it looks like. And it sticks all over to it. And so as the charcoal collects whatever it's drawing from the body, whether it's the breast cancer, the lung cancer, the gout, the uric acid, whatever it's pulling out, or the infection, as it pulls it out, it will fill up. And then all of a sudden the pain starts again. Well, that way it's full, throw it away, and then put another one on. And then the pain goes back down. So you change it as needed. So now, if you have a wound that's open, put you a piece of wet paper towel there, or sheet, whatever, and then put that on top of it. Then put you that cellophane on top. The reason I put the cellophane on top is why? One, it's messy. Two, I want to keep it hydrated. I want to keep that moisture in there, and it works very, very well. Again, you can put it in the refrigerator. It will easily last 5-6 days. If you make a big one and you don't need it all within that 5-6 days, cut it in half, roll it up, put it in a Ziploc baggie, put it in the freezer, and it will last months. Or if you want to have it where it's ready, I'll caution you, if you put it in the freezer and it freezes, and you take it out and put it in the microwave, which that's fine. You want it warm. Usually I make it with warm water if I'm going to use it immediately. Now, what does warm water versus cold water, how does that vary the effectiveness? Warm water is a vasodilator, so you're going to draw more out. So you want it warm when you place it on the body. You don't want it cold. It's a vasoconstrictor, and you won't draw as fast. So you put it in the microwave, it will get really hot, and it'll thaw out. Be careful because the psyllium holds the heat pretty good. So make sure it's not too hot that you don't burn the person you're working with. Normally I have enough to go over the edges, but anyway. If you want to pass this around, I can feel of it. Be careful though, the edges are open and the don't get it on your clothes. It can stain. So that's a charcoal poultice. Very, very effective. It's a tremendous tool that you can have in your arsenal that can help. And read about how to use a charcoal poultice. It works for pain. I've seen people use it for like knee pain. Just all kinds of things. Now let's go back to the herbs. We had the bulk herbs where we were looking at the things that it's good for. And then we have the extracts, and I didn't make an extract. Let's look at these essential oils. I'll come back to extracts. Essential oils are very powerful. Let's say you have a person that has anxiety. Anybody know a person that has anxiety, stress? I mean, I have had people come in that are literally about to be Mount St. Helen. I mean, they're about to blow up. I had a man come in one time. He's a Vietnam vet. His left eye was just twitting, just going up and down like this. Right eye was fine. This one's just going crazy. He says, I'm having a PTSD attack. So what I do to those folks is I'll put 1 drop of lavender, and I put it just 1 drop. Be careful, lavender drips very fast. It's very thin. But you want 1 drop right here where your pulse is. Where's it going? You want it here. It's away from you. It's not around clothes, so that's why I choose right here. It's going to go into where you feel the pulse because I want it going into the blood. And it's going to transdermally go into the blood, just like a nitro patch, a nitroglycerin patch, or a nicotine patch. It's transdermal. And so it's going to go into the blood here. So I put just 1 drop. Then I'll take and I'll rub them here. So that's going into the blood here, and it's going into the blood here. And then I have them breathe it. And then I'll take the vetiver, and I'll put V-E-T-I-V-E-R. Vetiver, V-E-T-I-V-E-R. Now, vetiver drips real slow. I mean, it's like molasses. And it takes a while. And finally, you'll get 1 drop. Rub it, and the same thing. And just have the person just sit there. When they breathe it into the lungs, is it going to get in their blood? Is it going to get in their blood? Absolutely. It's going to get. You want it in the blood. And so you're getting it into the blood transdermally. You're getting into the blood through the lungs. And literally within 2 minutes, they can calm right down. I was standing, working, talking. I had a group of ladies there at the store, and this girl comes in. And she's over here, and she comes up, and she is shaking like a little chihuahua. I mean, she's just, and I said, just a minute. Something's wrong with her. I went over and I said, are you okay? And she says, I'm having an anxiety attack. She was about to go nuts. Well, Walter was sitting over helping a lady with something sitting down at the herb cabinet. And I thought, okay. I said, just a minute. Are you willing to do something for me? Whatever, help me. So I went back, told those ladies just a minute. So I went back and I got these 2 here. Now, I've never met this girl before, never. So usually folks don't trust you if they don't know you. So I said, can I show you? So I put it on me. I showed her how to do it. I said, are you willing to do that? And she says, yes. I said, okay. So I put it on her. And what else did I do? Exactly. You pray. This doesn't heal. You ask God. And so I asked God to bless it. And I put it on her. And I said, let me help these ladies. If you can just stand here and just breathe. So I went back over, started helping these ladies, kept watching Walter over there. And then it has been about 2 minutes. Walter finishes up with that person, and I have a special whistle Walter can hear. And I said, and so he knew, go to her now. And so he went over to her, and he starts talking to her, and she sounded like a different woman. Did not have the same voice at all. I finished up with these folks. I went over to her. She's talking to Walter, and she says, what did you just do to me? She says, it's gone. It's totally gone. I had these 2 fellows come in one time. This lady brought her husband and her son in. And I've never seen this happen before. I've seen women do it, but I've never seen men do it. This father and son were just shaking, and they were just hugging each other. And I'm thinking, what's wrong with these 2 guys? And I'm trying to figure it out. And she says they have extreme panic attacks, especially when they ride in a vehicle. I need help. So I went and did the same thing, put it on both of them, and they calmed down. They left, and I said, try it out, see if it works. If it works, come back and get some. The lady called me when she got home. She said they did not have any panic attack driving home, none. And she says, when I come back in town, I'm getting some of that. And she did. She came back. I saw her. Now, this has been several years ago. I saw her son this summer, and he came up and thanked me. He said, it's amazing what that stuff is able to help us for. And he's just so thankful. So it works good. One is, who's ever heard of thieves? Thieves oil? Thieves oil is very powerful. It's a mixture of different essential oils, and you can read the story of where these thieves went and they were grave robbers, and they put this on them, and it kept their immune system so high as they dug down to the graves and broke them open into the caskets and stole stuff off the dead people. Back years ago, they used to, like army people, they'd put their sword in there and they'd put their watches and whatever. They'd steal that stuff, and they didn't get sick. Well, they finally got caught, and something happened to them. But anyway, they did this for a long, and this is very powerful. Vanderbilt. Who's heard of Vanderbilt? My brother works there. My sister-in-law works there. Vanderbilt did a study with this right here back several years ago, and they would test pathogens on a surface, and they would test how long it took for the pathogen to come back, just coming through the air. And they then put this product, exactly this right here, sprayed it on the surface top, and they kept, and it was not long, normally, how quick the pathogen, they could retest it and find it. They then went and would test this thing multiple times a day. It took 7 days before a pathogen could live on top of the surface with this right here, this product right here sprayed on top of that table. It's amazing. It works very, very well for any type of viruses, bacteria. Eucalyptus. There was a study, if you go to my Facebook page, I put it up back a week ago, I guess, a study on this and garlic oil. A physician wrote an article, NIH published it, and it's amazing how well these two items are working for addressing issues with COVID. I will have people who call me and with difficulty breathing, and when you nebulize eucalyptus. Now, have you ever used Vicks? Of course, you grew up in Knoxville. Vicks is, my grandma had Vicks 365 days a year, 366 days a year when it was leap year. I mean, it was in her purse. And you could put it on your chest, put it in your nose. If you had sore throat, she'd take a big old glob and say, swallow it. And you'd slowly swallow it, and it would get rid of sore throat. You had petroleum jelly in it, but it was the eucalyptus. It's so powerful. And a surgeon told me years ago, actually 2 surgeons told me years ago, if you have a patient that you're needing to use albuterol, who knows what albuterol is? Albuterol has some very challenging side effects, and some people get in the donut and have financial issues. And they said, what you do is you take your nebulizer, and instead of putting your albuterol, you put your distilled water, 2 drops, just 2 drops of this, and you nebulize it. And it works better than albuterol. And we've been using it for folks in replacement for albuterol for probably 19 years now. And it's also working extremely, extremely well for people who have respiratory issues with COVID. Clove oil. Who's used clove oil? What's it good for? Toothache. Yeah. If you got a toothache and you can't get into the dentist, go pick you up some clove oil. It is amazing for helping the pain. It also is great for killing cancer. Clove oil is very good for cancer. This is one of my favorites. This is Alimed. It takes 24 of these right here, 24 of these to make 1 drop of this. 24 of these to make one drop. It takes 2,240 of these to make 1 teaspoon. I buy it out of England. We sell it to physicians all over the U.S. We even send it to Africa. We send a lot to Canada, and other countries. I used to send it down to Venezuela until they went nuts. We're a wholesaler to physicians, and so we send out a lot. And physicians will use it. They use it for MRSA. It blows the doors off of vancomycin for if you're using MRSA. The gentleman I talked about yesterday that had that vancomycin-resistant infection that I talked about yesterday, this is what we used. My son had Lyme disease, my youngest son, and we tried for, it was 7.5, 8 years, and it wouldn't go away. And so I called these guys and I said, do you have anything for Lyme? And they said, yes, the Alimed. So we did the Alimed, 1 teaspoon BID twice a day for 3 months. Gone. Lyme disease was gone. Came back 6 months later. We did it for another 30 days. This next March will be 9 years since he's had any symptoms of Lyme disease. It's extremely powerful. I like Alimed. Take it every day. Right now. Normally I don't take things, but right now I see a lot of sick patients and a lot of sick people coming in, and they come from their doctors. A patient can come and see me. And Alimed, Allimed. Allimed, Alimed. But it's extremely, extremely powerful. Vitamin D, I was going to show some of these Friday night, and remember, these got left on the airplane, left in Charlotte and finally made it back. Vitamin D is very good for your immune system. We talked about that Sunday evening. It's not an herb, but it does come from sea vegetables, which is an herb. So actually this is an herb. I'm wrong. The next one is, let's make who's ever done a mustard plaster? Who's ever heard of a mustard plaster? Anybody? Okay, let's make a mustard plaster. So a mustard plaster is, we'll make it right here, is really good for lung issues. If a person has pneumonia, it's also good for pain. And I'll do 1 part mustard, 3 parts flour. 1 part mustard, 3 parts flour. Now you can use white flour, but whole wheat flour is not as sticky. And so I prefer the whole wheat flour. And you shouldn't have white flour anyway. So I'll do 1 part mustard. Now the problem with a mustard plaster, mustard is not measured in heating units like cayenne. Cayenne pepper could be 20,000. It could go up to 2.2 million. Anybody know the hottest pepper out there? Do you know it? Ghost, but now there's one hotter. It's the Carolina Reaper. The Carolina Reaper, just across the border over there, is the hottest of what they now tell us. But Ghost was what we thought. It used to be the hottest, the Ghost. Now they have the Carolina Reaper. But mustard is hot, but they don't measure the heating units. So be careful. You cannot use this. And let me stop and put this in bold and put it in red and put it in parentheses. Do not use a mustard plaster on a child less than 2 years old. Or even, they have to be able to communicate. Because if they can't communicate, it's hot, mommy, then don't put it on. Because it can blister the skin. You usually leave it on for about 10 minutes to 20 minutes. It's a very safe tool to use. Just use it on somebody and say, it's starting to get a little warm, then take it off. Don't say, no, Walt said you had to have it on there 20 minutes. You know, they just may be blistered when you take it off. So 1 part mustard powder. And if you only have mustard seeds, it's not enough, not a problem. You just put it in your coffee grinder and blend it up. Don't put your hawthorn berry in the coffee grinder. I tried that. It broke the blades on the coffee grinder. They're so hard. So now you're going to mix it again like you did on the charcoal poultice. The flour is only a binder to hold it together so it's easier to manage and also to hold the moisture. Because again, it takes moisture in poultices, any of the poultices. And I just thought of a poultice I'll show y'all. You want this about the viscosity of biscuit dough. Now you're going to have to teach them how to make biscuits so they can know what biscuit dough is. You want about the same viscosity as biscuit dough. Now our folks listening from East Tennessee on our Facebook, they know exactly what biscuit dough is. Now if you get too much water, what do? Just add more of the mustard and flour. You want it moist enough that it works. You know, these treatments take a little bit more time than just putting on a pharmaceutical potion. But I tell you what, they just don't have the side effects. And they're a whole lot cheaper. You can grow them in your backyard, much of this. A lot of people ask me, they'll say, Walt, I'd like to start an herb garden. What should I grow? I'll say, I don't know. What problems does your family have? Does your family have health problems? If so, grow herbs for those health problems. I'd start with about 10 herbs at first. Get to know those guys. Get to know how to grow them well. And then start adding. What kind of problems does your neighbor have? Start growing those herbs and give it to them. What a way to help them. You know, you've heard about giving bread to people. Well, you can give your herbs to people. That's good right there. I've used it for arthritic pain on the knee. Pardon? I've used it for pain. I've used it but mostly I use it for lung issues, lung congestion. If you have pneumonia, this is a great tool for pneumonia. Again, it has to be a person who's able to communicate. So it may be an elderly person that cannot communicate. Don't use it on them because they've got to be able. This one, they have to be able to communicate. Now, how thick did we make the charcoal poultice? 1/4 of an inch thick. Now, charcoal poultice, can you use it over and over? Charcoal, you can, well, actually, the doc's right. You could if you could wash it out. You can literally wash out charcoal and reuse it. But we usually just throw it away. It's kind of hard for our ability, but theoretically, you can wash out charcoal, and it can wash the pathogens out and then reuse it. This guy, you can use it over and over and over again. And so what you do, you put it on the area, leave it for 10 to 20 minutes, take it off, put your cellophane back on it, and you can use it 5-6 times. One time I don't remember where I was, and I just don't remember where it was. And I asked Dr. Agatha Thrash, I said, Dr. Agatha, you know what horse sense is? Y'all know what horse sense is? Common sense. You just have to use common sense when you're doing stuff. And so I was thinking, you know, we're after the lungs, and the lungs are between the ribs, right? You got ribs here, lungs. In the back, you got ribs, lungs. I said, I've only read and heard of using a mustard plaster on the chest. Why don't we put it on the back? She says, That makes sense. Yeah, you ought to be putting it on the back too. You're going to get better relief. So you can put it on the back also. And then you can just use it over and over. What does this do physiologically? It pulls blood to the area. That's all it's doing. Perfect health is perfect circulation. Yes, perfect health is perfect circulation. And so what this is doing is pulling more circulation to the area to bring more nutrients to the area to take waste away, increasing that circulation, what circulation does, and that then faster healing. If you want to pass this around. And this one you only do about 1/8 of an inch thick. Okay. Yes, I've used it on people who've had knee pain, like arthritic knee pain. That just increases circulation. And also, it may also do what that cayenne pepper did. When you use capsicum as a cream on say arthritis, let's go back to when we were kids. Did you ever do something like stub your toe and your daddy say, "Let me see your other foot a minute"? You know what I'm talking about? I'll step on that one. You won't feel that one no more. Well, that's what's going on. When you're putting cayenne, as I talked about that lady yesterday, it's stimulating nerves, and it kind of takes the brain's attention off of it. There's one I learned. Oh, we got Romanians here. Who all of y'all are Romanians? Okay. And okay, what do you do for a person in an epileptic seizure in Romania? In the hospital, what's the treatment? Well, I was in a care plan one time, and we had this epileptic come in as a patient. So we're care planning our patients, and we finish the epileptic, and the Romanian nurse says, "You didn't put on there to bite their finger." Have you ever heard of biting their finger? Exactly. Yeah. Well, yes. So she says, "Why didn't you talk about biting their finger?" Exactly. And I looked at her like she is from Mars, and I said, "We don't bite people's fingers here, and that's just not normal health care. Going biting people." Pardon? Yes. So I'm thinking this is a little different, Maria. And behind me, over here was a therapist from Korea, from South Korea. She goes, "You don't bite their fingers in America?" I'm going, "Oh boy." "Do you bite their fingers in Korea?" "Yeah." I was like, "Duh." I'm thinking, oh wow. So several months later, Dr. Gabriella and Leslie Toland came. They were doing locum tenens with us. I thought, I'll find out. And so they were in my office. I talked to them, and we were just met each other. And I said, "I got a question for you. What do you do in Romania when someone has an epileptic seizure?" And both of them looked at me like, "You bite their finger." I'm going, "Are you serious?" "Yeah. You just take your lab coat and pull up and bite the finger." And then what it does, it distracts. So I've got a good friend. He's German. I asked him that. I said, "Sam, what do y'all do in Germany?" He's a physician. He goes, "No, we don't bite their finger." He goes, "We just go and we pinch them." He goes, "We go and we take our finger and we grab their earlobe and we grab their little pinky and we just go." Yeah. Yeah. It works. It distracts. And that's what happens with the cayenne. It distracts. And I know that also the mustard plaster pulls blood to the area, but it's hot, and it may also do some distracting like the cayenne does. Okay. Don't bite people's fingers. Be careful. I was flying. Yes? Pardon? Would you like to do that? Okay, is there someone can get a picture? Anna, can you help us there with the, what's a person called? The esthetician? Yes. Can you get a picture of both of them? Yes. Yes. All right. Go ahead, ma'am, when you're finished. So, water. Yeah. Thank you. How does it feel? Caked? Tight. Yes, tight. Yes. Okay, we'll see you in a minute. Okay. Let's do another one. Oh, yes. You're Romanian, of course. Cabbage rolls. So this is called a cabbage poultice. A cabbage poultice can be used for many things. It can be used for hemorrhoids. It can be used for pain. I had a patient that flew in from from England, and London actually, and he had super bad hemorrhoids, and they were external hemorrhoids, and they just couldn't fix them there, and he didn't want to have surgery, so he flew over to the clinic I worked at, and one of the treatments we used was cabbage poultice. Let me show you another one. This is called hydrotherapy. So y'all know what a bedside toilet is? Y'all know what a bedside toilet is? Okay, so you take the bedside toilet, you take the pot out, and you have them sit there. Then you use hydrotherapy, and we have these hoses. It's called a douche. There's a French word for you, right? And so it's called the douche. And douches are tremendous. One of my favorite hydrotherapies. I like using a hose that has a diameter between at least 3/4 of an inch diameter to 1 inch. The best douche I ever had was a waterfall in Venezuela. Oh man, it was amazing that I was able to get up, and it just gave me such a massage. And so what you do is you have your hose, and then you control your water, whatever temperature, hot, cold, medium, warm, whatever, just like you would your shower. And so what you do is you have the patient sit on the chair, obviously nothing on from the waist down, and you get behind them. Now, when you do therapies, men on men, ladies on ladies, except husband and wife. So what you do is you get this was a male, and so we had the male therapist. What he would do is he would take the douche, and he would massage the hemorrhoid from the bottom, because as the person sits down, it causes the hemorrhoid to drop down more. And so you massage it with what first? Hot. And just as warm as hot as they can tolerate. Don't burn them. And how long do we do it? For about 3 minutes. And then he would change it to plumb cold. Now, if they have neuropathy or a wound, then you do 100 degrees, 70 degrees because of the circulation issues you're dealing with. But if it's not that, then I'll do as warm as they can handle it and plumb cold. They can do ice cold if you want to, but I just turn it totally cold, and then you massage it for 1 minute. Then you go back, hot, 3 minutes, cold, 1 minute. Vasodilation, vasoconstriction, vasodilation, vasoconstriction, increasing that blood flow to that hemorrhoid, and which perfect health is perfect circulation. And so that's bringing more nutrition to the area, taking away waste, bringing more nutrition, taking away waste. Then we did a cabbage poultice. And you beat it to where it will bleed. Let me do it this way, based on how this one is. You can take a hammer. You can take whatever you want. You can put it in a Cuisinart if you want to. Just it's easier if you can make it do this way. It's less to fall all over and make a mess. But this way works very well. This is what most people do. And it's called making it bleed. You're fracturing the walls because you want that juice fresh, and you apply it to the affected area, and then put you a bandage on it. You can use it for pain. Let's say a person breaks their arm. You can put it on there until you can get some medical attention, but it helps with pain. And he was doing fine until one night he called me, and he was getting ready to go to bed. It was 9 o'clock, and I was still at work, and that's one of the reasons I moved back to East Tennessee, so I could have some family life. And so he needed the cabbage. So I went and looked in the refrigerator, and the green one, we were out of green ones. All we had was the red cabbage. I'm thinking, I don't want to drive into town. That'll take a good bit, and coming back, I'll just use this red one. So I got the red one, and I made it. He put it on. The next morning, he come out, and he says, I stained my underwear, stained my pajamas, I stained your carpet, I stained the sheets. He stained everything. So I learned never to use the red cabbage again. The green works very well. It will work physiologically, but just makes a terrible, awful mess. But cabbage poultices are good. You can use it for wounds also. You can use cabbage poultices for wounds. Let's say I'll do there's another class that I do. It's Old Mountain Remedies by diagnosis. And this one is just hands-on, but there's one in here by diagnosis, and where I go through all different kinds of treatments, and I talk about how to heal wounds. And if it's an infected wound, I'll do a charcoal poultice, or you can do a cabbage poultice, and that helps to pull out the infection. Okay, let's look. I'm keeping an eye on our time. I tell you, you want to help us? All right, we're going to make this guy right here. We're going to make an onion honey syrup, cough syrup. There you go. And so what you do is you're going to take an onion and you're going to cut it, and you're going to holler it out like a bowl. You want to leave about a ½ inch around it. And you want to be careful on the bottom when you're getting it out of the bottom, because when you get it out of the bottom, there's a piece that sticks down. If you're not careful, you'll pull that out too, and you got a hole in the bottom, and you have a hole in your bowl. And so your honey will run out into the pot. So what we'll do, we'll use this one here. Can you help me? There you go. If you can get me about an inch of water, inch and a quarter of water. She's from Knoxville, Tennessee, just down the road from where I'm from. And what happens as you put it in there, you're going to put it on simmer for about 20 minutes. And it's going to cook it. And the onion will go into the honey. And then you take a spoon of the onion, and you use that as a cough syrup. Yeah. Oh, no. You want to go all the way to you're about a ½ inch from the bottom and a ½ inch on your side. So it's a pretty good sized bowl, like you're making a wooden bowl. All right. So while she keeps working on that, yes? Pardon? Oh, we're going to put honey on the inside of it. Yes. Oh, thank you, ma'am. Perfect. Thank you. So what we do is we have our, we've got our water here. While she's doing that, she's cutting it out, and you want a ½ inch around it, because you don't want to cut too much away, because you want the onion there to come into it, but you need it big enough so you can stick enough honey in there that you get some. Yes. Very good question. You want to use local honey, number one. Local honey, because it has the local flowers and things in it that are in your area. You also want to make sure that it's raw honey and that it's 100% honey, because there are how's it feel? Yeah, hubby, what do you think? Yes? Isn't that neat? Is that a treatment you may do from now on? Literally, I will do this, and the ladies go, this is going to be a treat. I'm going to start doing it. The husband goes, yes, that's something you need to start doing. Yeah, all right, good. So, all right, so honey, there are people that will cut their honey, and they'll put, say, high fructose corn syrup. Now, I don't want to eat high fructose corn syrup. Now, in Tennessee, there was a law that was passed actually by our state representative whose wife is a nutritionist, and she identified people were putting high fructose corn syrup in honey. And she says, what if, let's say if your little boy, let's say your little boy is allergic to corn, and you bought honey and you thought you just had honey and you have an allergic reaction. So in Tennessee, the law is now, if it says 100% or pure, it has to be 100% or pure. Okay, so we've got okay, now let me show you something here. Let's see here. Okay, if you can come here. Okay, see how you can get a little hole in the bottom. So what we want to do is we want to patch that hole. It's real easy. That's why I had her do it, because I usually have the hole. No problem, I do it too. Okay, so I'm going to patch the hole and in there. See if because it will leak out into, it's just because the way the onion's made, it does it. Now, what I'm going to do is put it in the water, and I've got about 1 inch of water there, 1.25 inches, and then I'm going to pour the honey. All the way to the top. There we go. It's ready. Okay, Miss Knoxville. You want to put, whoa, no. Be careful, it tips over. You want to put it on plumb low and just let it simmer. Okay, so we're ready for that one. Now, the next thing we're going to do, thank you, Anna. The next one we're going to do is we're going to make a tater poultice, a potato poultice. Now, you can either peel it or you can not even peel it. Where is it? Here it is. Yes, yes, so I just leave skin on it. Hey, perfect. When I was a boy, my grandmother would make potato poultices. It's really good for burns. One day, I was at work, and this guy comes in, he's Filipino, and he's a maintenance guy, mechanic, maintenance guy, and he came in and he was injured. Okay, I'll come back to that. And what had happened was he was working on a furnace, and he turned the propane off the furnace, and he went into the furnace room, turned the lights off, turned the lights on. The light didn't work. So he went over to the furnace, and he got his little big lighter to look at the furnace. He gets down, and there was a valve leak, and it exploded. And it burnt him from here up, burnt his eyelashes, eyebrows, his hair off. The skin was totally burnt. And then he looked like, you ever seen a 1950 car that has flames on it? That's what his face looked like. Then there was flame, it was burnt, and then flame marks on it. So he came in, and we laid him on the exam table, and I told him, I said, go up to the kitchen and get me some aloe vera and grate some onions. And so they grate some potatoes. And so they started grating potatoes. And they brought me a quart of aloe vera gel, is what they had. So I used what we had. I put that quart of aloe vera gel all over his face. I kept pouring it on, and it literally soaked the whole quart up in his face. Then they brought me the onions. Potatoes. And we put the potatoes on his face like this, and then I poured more aloe vera on it. And we were doing it about every 5 minutes because this would get hot. Have you ever been sunburned and used vinegar? Oh, it's great. Yeah, if you get sunburned, what you do is you get you 2 bowls, and you pour in vinegar, and you put your washcloth in it, and you wring it, and then you put it on the affected area, and the washcloth will go from cold to hot because it pulls the heat out. See, when you have heat, is our EMT here? Our EMT's not here today. When you are burnt, it will continue penetrating for up to 12 hours, is what they teach us in school. And so you've got to stop the burning process. And so that's why when you go and get sunburned, and then at midnight you are cooking because it's still going deeper and deeper. So you put that washcloth on there with the vinegar. When it gets hot, you pull it off and you wring it out in more vinegar and you put it back. And finally, your bowl here is hot. You put that in the freezer, and then you use your other bowl, and you keep going until your washcloth does not get hot or there's no more heat. Totally? Okay. And so, and then you put aloe vera. And then when it heats up again, you do that again. Well, the same thing here. These would get hot, and then I'd take them off, I'd put more. And we just kept doing it over and over. We did it for 5 hours. And when we then showed the wife what to do, this man had no scarring. None. No scarring. It was amazing. God is good. You know, this is not the first thing we did. We prayed. You got to pray, y'all. God's the one that does the healing. It's not potatoes. It's not aloe vera. Okay. We're running out of time, y'all. I told you this is a hard class for me. There's so much to share. I was in Dallas, Texas teaching it, and I kept going, and finally at 6 hours, I said, guys, we need to quit. Okay, what can I show you to do that I haven't? Let's make the rocket fuel. Let's make the rocket fuel. Okay, we'll make time for that. Okay, so we're going to make rocket fuel. Who's had rocket fuel? Anybody had rocket fuel? Okay, come on, help me out. Let's do rocket fuel. Can you get my computer bag out of the back of your vehicle? I think it's in the back of your vehicle. My computer bag. Thank you, sir. Okay, rocket fuel is something that one time I hired this therapist out of Oregon, and I was sick, and she made me some rocket fuel. Now she put 10 cloves of garlic. I'm only going to give y'all 5. She put 10 cloves of garlic, and she put a half a teaspoon of cayenne. I'm only going to do an eighth of a teaspoon. I took a sip out of that, and I set it down. It was a mason jar. She said, drink all. And I just set it back down. She comes walking over. She says, drink it all. And I said, I drank only half of it, and I was sweating. It was powerful. I'm only going to put 5 cloves. So we want 5 cloves. There you go, yeah. We're going to do 5 cloves, and then we're going to do a half of an onion. All of these are antiviral. Everything here is antiviral. And you can kind of just chop it up cut it up a little bit. Okay, now we're going to squeeze the juice of 2 lemons. Thank you, sir. If you can give everybody one of those. One of those. Thank you. There we go. We're going to do a piece of ginger the size of your thumb, which is called a thumb of ginger. Oh, you can just stick your plum in there. You don't have to cut it up. You don't even have to. All you do is just take cut it and stick it right in there. You're going to do 2 tablespoons of honey. Now, I don't have a tablespoon, but you can kind of just guess 2 tablespoons. Now, if Mary Lou was making this, she would do 3 tablespoons. There you go. 1/8 of a teaspoon of cayenne pepper. Now, again, cayenne pepper has different heating units. You can get it as little as 20,000. You can get pepper, like I said, as much as 2.2 million. Cayenne pepper is normally in the 80, 90, 180,000 range. And let's see here. Pardon? Not yet. Oh, let's go ahead. You can go ahead and what I do is I put water in it up to about right here. There you go. And let me add one more thing. I'm going to put Alimed. I'm going to put about a tablespoon of Alimed. Who's good with math? 2,240 times 3. 2,240 times 3. Almost 7,000. Yes. Yeah, okay, good. So we're going to put about this is Alimed. So it has how many cloves of garlic? 6,000. 6,720 cloves. If I did where did I pour that? In here. Good. I didn't pour it in there, did I? I did? No. We're going to pour that in there anyway. Thank you. So go ahead and continue pouring it in here. Poured it in the wrong one. Okay, we want to net. Okay, go ahead and blend what we have. Go ahead and blend this. I usually cover it, blend it, and then I'll add enough to net a quart. Is that a plump quart? Not quite. Is it? Does it need a little more? How much? Thank you, sir. Okay, let's go ahead and blend that. Okay. Okay, go plum. There you go. Okay. There you go. And then we're going to net. How much do we need in there? What's it say to a quart? How much more you need? Here you go. Okay, that looks good. There you go. Okay, blend her a little bit more. Okay. I usually put elderberry in there, but I wasn't able to bring elderberry with me. So it's ready. So we've got, what do we have in there? So you want to read off, someone read off what's in there? So we've got 5 cloves of garlic, half of an onion, 2 lemons, 2 tablespoons honey, 1/8 to 1/2 teaspoon of cayenne, 1 thumb of ginger, 1 to 3 teaspoons of elderberry. 1 to 3 teaspoons of Alimid. I usually do warm water, but the cold will be fine. Y'all ready? Okay. All right, go ahead. We're going to pour it up and y'all taste it. All right. If you'll start doing that, I'll go ahead and start answering questions. Let me show you one other item I just saw when I opened my computer bag. This is one of my favorites. I pulled it out last night because I was just if you live up on a country road and it's got potholes in it, and you're always driving on potholes, you don't know what good is. But when you ride on an interstate and you feel a hot pothole, you feel it, right? So if you're riding potholes all the time, pothole doesn't mean anything because you're used to the potholes. But if you're on the interstate and you're smooth all the time and you feel a pothole you feel it. So if your health is good, working well, and you hit a pothole, you feel it. Well, last night I was just feeling a little pothole. And so I went and got this and took me 10 drops, and I was fine this morning. It's oil of oregano and olive oil. 1 part, 25% oil of oregano, 75% olive oil. It is phenomenal. If you feel like you're getting something, but it has to be in the incipient stage. I was already in bed trying to go to sleep, and I thought, I do not want to get out of bed. But I don't want to get up in the morning and have a sore throat or anything. So I got out of bed, got this, took 10 drops, got back in, I'm fine. It's amazing, amazing what it does for you. Okay. Everybody, yeah. Okay, let me see how it tastes.
Is oregano oil just good?
Oh, that's not bad at all. If you put it straight on the tissue, what's called neat, N-E-A-T, that is not mixed with anything, it can burn the tissue. It can burn the mouth. It can burn the esophagus. It can burn the stomach. So it's good to mix it with like an olive oil. Even just putting it in water, it can burn a little bit because water and oil don't mix good. So when you mix it with another oil to dilute it, then it works very well. And all I did was stuck it under my tongue and dripped it. Now, don't do that. You don't think I'm trying to kill you. It's strong when you swallow it until you're used to it. This isn't strong, y'all. Pardon? That's correct. 1 part oregano, 3 parts olive oil. And this isn't strong. This isn't bad. The garlic and all, this is good. No, this wasn't bad at all. And maybe, yeah. So this was easy. And so what you do is you drink a quart of this in about an hour. What'd you think? You haven't tried yet? Okay. Tell me what you think. This really isn't strong. What do you think? It is, yeah. When you put elderberry, it makes it a lot easier. Yeah. It makes it a little sweeter. Yes. And you get extra benefits from the elderberry. Well, we've run out of time on demonstration. We've got another about 15 minutes for, is that right? Questions. And so we'll take questions from here. You're going to be questions from YouTube. Okay, great. So y'all in YouTube world, send your questions in and we'll answer those. Yes.
My wife wanted me to ask, can rheumatoid arthritis be reversed through lifestyle like diabetes?
Is there a microphone we could use? Okay, great. Excellent. The question is, you want to ask your question again?
One, two. My wife wants me to ask, can rheumatoid arthritis be reversed through lifestyle changes like diabetes?
Rheumatoid arthritis can be significantly lessened and even possibly reversed. My mom had rheumatoid arthritis so bad we had to move to Florida when I was a kid. What she found to work the best was alfalfa, and she'd use like 30 pills of alfalfa a day, and it worked very well. You want to back up a little bit. Look to see if you can find, is anything an irritant to that. And I would take a look at this guy right here. That guy right there can make arthritis worse. Flour, wheat. And dairy, yes. And so the first thing I would recommend, and Dr. Agatha taught me this years ago. She told me that just one cracker can kick on arthritis pain for 2.5 months. Isn't that amazing?
Yes, and sugar also.
And sugar, yes.
They notice over the years you need to remove the causative agent.
That's right.
You can take all these treatments, and it's not going to work if you don't remove the
You got to go to the root cause. As I showed the other day, rubbing with the sandpaper. You've got to stop using, you got to identify what the cause is. And so where a person goes dairy-free, where a person goes gluten-free, sugar-free, that makes a huge difference. It really does. So that's what I would do, is try to get rid of those causes. Now, I'll tell you one of the best things I found is getting a person to do, if you want to really cleanse the body, is to do a vegetable juice cleanse. Do it for 60 days, and it can clean the body very, very well. 60. Mm-hmm. You're doing 16 ounces of vegetable juice. You can have some apple in it for breakfast, dinner, and supper, and do that for 60 days. It's amazing what it does for purifying and cleaning the body, cleaning the blood, cleaning the cells. It's going to be in the blood within 15 minutes, and it just works very well. So that's what I would try first. As she said, we can mask and manage. Try to get to root cause. Okay, next question. Oh, we got several here. Okay, yes, ma'am.
I would like to ask if the baby has a diaper rash, what would you use?
I like calendula or calendula. My daughter makes a cream that has calendula. You can put comfrey and plantain in it, and that works. That's what she uses, and it works extremely well for diaper rash. So calendula or calendula, it's calendula. It's a flower in the same family as marigold, and then has comfrey and plantain in it.
Right here.
Yes, ma'am.
Your suggestions on sleep issues, like, not able to sleep continuously for 7 or 8 hours.
That's the hardest thing I'm working with right now. That's the biggest thing people are coming in complaining with, is not able to sleep. And you want to look at, again, what else is out there? Is there a lot of stress? How's their diet? Are they eating a big supper? We know that if you eat a big supper, it putrefies and ferments, and it causes problems in sleep. We know that you don't make as much melatonin if you eat a big supper, if you don't go to bed by 9 o'clock. If you don't get sunshine to convert the tryptophan into serotonin, and then going to bed early and not eating a big supper, the pineal gland will convert the serotonin into melatonin. Going to bed with stuff here. Either if you're thinking about work or you're upset about something, write it down on a piece of paper. Let that paper remember it tonight. Next morning, you pick it up and stick it back in your head if you want to. But let the paper worry about it tonight. Make sure the bed the room is cool. Not cold, but cool, not hot. Hot actually wakes people up. They've come up with this new bed, and the bed cools down to help people sleep, and then you set it as an alarm clock. The bed warms up in the morning, and it wakes you up. So you want a cool room. And another thing that we're seeing a lot today is a bed should be used for a bed is made for, sleep and for relations. Not for a study room, not for watching TV, not for doing work. Do that somewhere else. The bed, when you get in bed, beds go to bed. And so if the brain correlates that, and there's a really good National Geographic, I think it was. National Geographic just came out with a new magazine recently on sleep. And I saw that in there, and I'm seeing it other places. That's a big issue. Go to bed, only use the bed what the bed's made for. If you don't, brain gets messed up. The lights plumb off. There's no light in the room. There's even folks say you shouldn't even have a light on your alarm clock. You want it totally dark. No noise. It needs to be... Pardon? The TV, right, the TV shouldn't even be in there. You're exactly right. Put the television somewhere else. You're right. And then people, they sleep with their radio going. My challenge is, you know what my personal challenge is? That right there. This right here goes off in the night. Well, I have to have this on at night because this is how they notify me out of Carolina that I have a call in North Carolina. And dispatch out of Haywood County will send me a text. And so I have to listen for a ding. Well, it wakes me up, it wakes Mary Lou up. But the problem is if I don't just isolate them, it might be folks in Africa because they're 7 hours difference in time from me. And so they're up going in 3 o'clock in the morning and 2 o'clock in the morning. If you can turn this off, it is the best. Now I know as we get older, we got kids and grandkids, and if there's a problem, we want to be there to help and whatever. But this can wake you up at the night, dinging all night long. Someone messaging you, whatever. That can be a problem. So what are some herbs or whatever you can use? Yeah, melatonin, but that's not the best, I found. Valerian skullcap, hops, passion flower, chamomile, those skullcap, those can help. Wild lettuce, all those can help you sleep. L-theanine is another good one that works well. 5-HTP, taking tryptophan can help. Magnesium is a really good one. I like using magnesium to bowel tolerance, to whatever that person can take magnesium-wise. If you take too much, it gives you a loose stool. So magnesium I found to work very well to help people fall asleep. There's a product called Calm, another one called Calm and Relax. I like that one even better because it's got some chamomile and passion flower, some herbs in it, and it works well. During 9/11, my patients out of New York City and Washington, D.C., they couldn't sleep. And so I called my friend, Dr. Strachan, I spoke of earlier, out of Loma Linda. I said, Dr. Strachan, what can I use for these people? And he says, here's what you do. 2 tablespoons of valerian, 2 tablespoons of hops, 2 tablespoons of skullcap. Skullcap, hops, and valerian, skullcaps, and hops. Valerian, skullcap, and hops. 2 tablespoons of each and 2 cups of water. Make a tea. He says it always works. Didn't work. Called him back the next morning. He goes, wow, it's always worked. Everybody, even a woman whose husband died and they're in hysteria, they'll sleep. So he said, do it at 6. So we did it 6-8. Didn't work. He said 4-6-8. Didn't work. It finally took doing a full dose at 2, a full dose at 4, 2 full dose at 6, and a full dose at 8. Knocked them out. And we had to do that for 6 months for all of our patients coming out of New York City and out of Washington, D.C. But that's very rare that it takes that much. So those are some things that I use. Pray. Ask God, to share and what you need. Another thing that my dad taught me when I was a kid is my brain was always running. I just like doing stuff. Sleep was a waste of time for me growing up. And so he would come in the room. He was always the one that put me to bed. And he'd teach me stuff that a man should do, responsibilities of a man, and just always telling me something, learning every night. And he would teach me he'd say, toes, relax. Just mentally, just relax your toes. No weird stuff. Just tell your toes to calm down, relax. And then tell your foot to relax. And he'd work all the way up. And it got to where I could fall asleep. When I was in high school, I worked at a factory, a furniture factory, and we had a 10-minute break. When the break went off, I could go lay on a pallet of wood and be asleep in less than 30 seconds because I taught myself to relax, just to calm the nerves down, calm the muscles down. Gone, I was asleep. So you can teach yourself to calm down and relax and do that. Again, it's not no weird meditation stuff. It's just telling your body to calm down. Next question.
Oh, you're right here. Yeah. Any remedies for migraines?
For migraines, you got to figure out what the cause is. Is it dehydration? Is it constipation? Is it their glasses, that they need new glasses? Could it be they need Walter, my oldest son, Walter, will start getting migraines, and he knows that he needs to go to the chiropractor, and the chiropractor can do a neck adjustment, and boom, the migraines are gone. It's amazing what being out of adjustment can do for the body. That's what I try first, is find out what the root cause is. Yes, you can do peppermint, you can do lavender, essential oils. There's another one called butterbur is an herb. You can try those. Make sure the person has plenty of hydration. Drink that, every, you want to do 4 ounces every 30 minutes. That much, 3 to 4 times a half hour. This needs to be gone in 2 hours. And that works very well. Also, dehydration problems with headaches.
Are they also related to the food?
It can be. It can be food allergies. Yes. Be careful on when you're looking at food allergies. Let's say you're worrying. Let's say it's nightshades. You're worried about nightshades. And so what some docs will they say? Okay, they'll go tomatoes, potatoes, eggplants, pepper, tobacco. Those are nightshades. Lobelia, that's a nightshade. And so the docs say, oh, let's try nightshades on you. Don't do tomatoes for 2 weeks. Didn't help. Well, it wasn't tomatoes. Try peppers for 2 weeks. No, it didn't work. Try potatoes for 2 weeks. Problem is, while you're stopping the one, you're still doing the others. So you got to totally stop all the nightshades, and then if for 2 weeks, if that helped, then add one at a time. Add the tomatoes, get a headache, take it away. Get clean again, try it again, double test it. Oh, yep, twice now I tried it. Gave me a headache. I'm not going to do that one now. So you can try going down to a baseline diet. And the one I like doing for baseline, it can be juicing. It can be doing the Duke diet. Try just and then start adding foods back in and see if that could be it.
We have some questions coming in through YouTube.
Okay.
Somebody's asking, what can one do to treat neuropathy?
Neuropathy. Okay. Dr. George Kim, who's a Korean, South Korean, he's in North Carolina, and trying to think of what town. It's in the eastern part of North Carolina. Very good physician. And what George is using for neuropathy is he uses B-complex, like a B-complex 100, and he'll use 12.5 milligrams of potassium iodine, like a Lugol's tab. It's a Lugol solution, but he likes instead of the liquid, go more towards because they found that the solution, the liquid, only lasts for about an hour and a half, where you can get a time release like a Lugo tab, it'll last 12 and a half hours. Now, for the first 2 months, George finds definitely the first month, nothing. Second month, usually nothing. In the third month, he starts seeing neuropathy disappear. And that's the best thing he's found. He's having good success using that. The other thing is something called far infrared. Far infrared is an amazing tool, and I encourage y'all to study far infrared. We use it for cancer, we use it for cardiovascular disease, use it for Parkinson's. What it does is it changes the water molecule in the blood, and you have better perfusion, and it's just amazing what far infrared does for the body. And George has found that to also be helpful in neuropathy. You can do warm and cool. Don't do hot and cold because, again, neuropathy, you may have a nerve issue, circulation issue. And if it's too hot, you can damage the tissue. So don't go over 100, maybe 103, but definitely 100 is good. Don't go colder than 70. 3 minutes warm, 1 minute cool. 3 minutes warm, 1 minute cool. Do it 7 times. You can put some Epsom salt in there on the warm side and do that 2-3 times a day.
Is there a treatment for ringing in the ears?
Oh, that's a hard one. It is. Ringing in the ears. Some people have found tea tree to be helpful. Some people have found ear candles to be helpful. Pardon? In the ear? In the ear? Mm-hmm. You've heard of ear candles and tea tree? When I was in Africa a year ago, this lady, the issue came up, and it's like where you're from. Those old folks where you live, they got some remedies, right? They do. He lives in the Caribbean, and they've got remedies. Y'all from other countries, your people have remedies. And the question of ringing in the ear came up, and this one lady goes, oh, it's easy. We use this. And I'd never heard the herb before. And I didn't get a chance to get back with her to write it down. And when I went back again, I couldn't find her, and I haven't been able to find her again. And she said, oh, it's easy. So there's a way to do it. There is something you can use. Get this one. Y'all know what kudzu is? Yes, Miss Knoxville knows kudzu. Kudzu grows everywhere. It grows the best anywhere in the world in the southeast United States. And in China, they use kudzu a lot. In Asia, they use kudzu a lot for a lot of things. But I found an NIH, and I was looking for how to deal with ringing in the ear. Was there anything herbal that NIH, National Institute of Health, had found? And they found something. And it was, find this one, kudzu IV. One, find kudzu IV. Two, find a doctor that's going to give you kudzu IV. But they found that kudzu IV was extremely good for ringing in the ear. So I'm still working on that one.
There's a few more on YouTube. It says, my daughter has miserable cramps every month, even to the point of vomiting when she's menstruating. What causes this and what can be done?
You want to stabilize the hormones. And the best thing I have found on stabilizing hormones is wild yam cream. Wild yam cream. You can use a quarter of a teaspoon morning, quarter of a teaspoon evening. We used to do it on the chest. We used to do it here. I like doing it here. And and you do it until she starts the cycle. And once she starts the cycle, you stop for 7 days. After 7 days, you start it again. Then on top of that, we use the nettle tea. We also use the flaxseed. Another is sugar, she mentioned before. Sugar a week before. Don't use any sugar. Processed. Yes. Yeah, any of the processed stuff, especially sugar, can exacerbate. Now, nobody's here from Jamaica, I don't think. I had this Jamaican, and I haven't tested it yet. I've told some ladies about it. They haven't called me back yet. But I had this lady from Jamaica call me, and she had some issues, and she shared this with me. And a Jamaican nurse friend of hers told her about it. And this Jamaican nurse friend helps a lot of women with said issue. And so what she does is she has them take a teaspoon of activated charcoal. Let's see here. She'll do it a week before the cycle, through the cycle. And she'll have them put it in their mouth, dry. Now be careful with this. You don't want to breathe. Put it in the mouth and mix saliva with it till it's a paste and swallow it. She said it worked better than put it in water and drinking it. And the only problem with this, only problem they found is it significantly to address the issue of cramps. The only problem is prior to the cycle, the woman would know something was about to happen, would take protection. The women didn't know that something was about to happen, and they had challenges with leakage. So, I don't know. Try it out. Yes, ma'am.
Can I share my?
Yes.
I used to have very bad cramps also. So since I switched to a whole food plant-based diet,
Yes.
that really helped.
It does.
And I notice now that if I have a little bit of processed foods or sugar, that definitely exacerbates everything. So from my own experience, switching to very clean eating, it helped a lot, a lot. So no sugar, no wheat, nothing processed, no dairy.
Yes.
Dairy is a big one because of a sugar content and then saturated fats. And another thing, they say avoiding oils. So anything oils. Mm-hmm. And if you eat oils, eat like a avocado, but not a lot, because that can trigger very bad cramps also.
Okay, good. So whole food plant-based diet with variety, which has no processed food and also no oils during that time. Another thing that women will use is they'll use a heating pad, and heating pads can also help.
We have one last question on YouTube, and it says, is there anything that I can do to help my significant IBS with multiple food and additive sensitivities that sometimes trigger colitis symptoms? I am gluten-free and dairy-free.
Okay, they've started. That's good. Okay, so yes, there is. There is, and let me share that. And it works extremely, extremely well, and I'm here because of that. It works. So first of all is you don't want the dairy. And I grew up on a dairy farm, y'all. And when I took nutrition from Dr. Campbell at Cornell, I found, are you ready for this? You don't want to hear this. Dairy, according to Cornell University and Cambridge University, Dairy is the most significant chemical carcinogen ever discovered. That blew me away. Our family was producing the most significant chemical carcinogen ever discovered. I mean, look at the responsibility. It increases a child's risk of type 1 diabetes by 1,100%. 1,100%. When I was a boy, my dad wouldn't drink. Mom always poured our glasses full of milk, but Dad wouldn't drink milk. And I said, Dad, don't you want some milk? Nah, I just don't care for any right now. Never would tell me why. Never would. Not until after Mom died. I said, Dad, why didn't you drink the milk? He says, when I went to UT, over at UT, he got his degree in agriculture there. They taught him back in the 50s that dairy was for a calf. It's not made for a human. It's a total different protein structure. Total different protein than y'all women who nursed your children. Total different protein. But yes, number one is what you want to do is you want to make a potato soup. Potatoes, celery, onions, and let's see, potatoes, celery, onions, and carrots. Make a soup in water. You want to eat a quart every day for 21 days. So that's your food for 21 days. The phytochemicals God put in the potatoes, the carrots, the celery, and the onions is amazing for healing the tissue. The next thing is aloe vera, 2 ounces, 2 to 3 times a day between meals. The other one is carob powder, 1 teaspoon twice a day, either in water or in applesauce. Also, activated charcoal, either 1 capsule or 3 capsules twice a day. That's your nutrition for 21 days. After 21 days, you continue the aloe vera. Also, there's a colon formula, and here's the formula for the colon formula. It's 2 parts psyllium seed husk whole, 1 part slippery elm, 1/2 part marshmallow root, 1/4 part peppermint, and 1/4 part spearmint. All of those are powder except the psyllium, which is psyllium seed husk whole. You mix those together, take 2 tablespoons in water 30 minutes before each meal. Everything you continue on after the 21 days of doing this, and I promise you, you'll get tired of it. I did, but I'm here today. My doctor told me I was going to die, and we put that regimen, and it healed the colitis, but ulcerative colitis. But I use this for both gastritis, colitis, ulcerative colitis, and Crohn's. After the 21 days, you then don't want anything raw because you've got tissue issues. And if you take sandpaper over road rash, it's going to hurt. So until that tissue is totally healed, nothing raw. No raw juice, no raw salad, no raw fruit. The only fruit you can tolerate is a banana, probably. So that means your fruit has to be applesauce, pear sauce, peach sauce, and then your vegetables have to be steamed or cooked. And it may take 6 months. Again, no dairy. They're not doing it. No wheat. No gluten at all. No caffeine. Caffeine, dairy, gluten, it's like pouring gasoline on it. No alcohol. The other one that is so hard, and that is stress. Stress exacerbates colitis and many other health issues. And so taking something like B-complex 100, taking 1 Q each meal, taking lithium orotate. This is not the drug. Neil Nedley talks about taking lithium. Lithium orotate, O-R-O-T-A-T-E, 5 milligrams, 1 each meal. Taking magnesium, all of those will help with the stress issue. Get your exercise and do the others. Okay.
There is one more that just came in. It says, what is the best way to balance your hormones when going through menopause? Okay,
the same thing as we talked about before is the wild yam cream, the nettle, the guy comes in one day and he says to Mary Lou, I'm over by the herb cabinet. I spend a lot of time over by the herb cabinet helping people. And this guy comes up to Mary Lou and he said, if someone don't help me, either I'm going to kill my wife or she's going to kill me. Well, when he started talking about killing people, that got my attention, talking to my wife about killing people. So I walked over to see what was going on with him talking about killing people. And so I went over, and apparently their relationship just wasn't too good. And so we had him do those three things: the wild yam cream, the nettle tea, the flaxseed. He said, okay. He said, if this works, he says, don't ever run out. So he came back a couple weeks later, and he goes, it works. It works. He says, I got my wife back. He goes, don't ever run out of this stuff. And so he always was the one that came back. And then, except one time, this lady comes in, and she mentioned to Mary Lou, she says, my husband came in, and this stuff really works for me. She says, is your husband so-and-so? Yeah. So we found out who the woman was about to kill her husband, and he was about to kill her. But that really makes a difference. And nutrition. Eat that whole food, plant-based diet. It really makes a difference. And we think, well, that's just, I don't like it. I like my, whatever, my chicken. I like my shrimp. I like my hamburgers. But what is the consequences? Absolutely. Absolutely. Okay. How are we doing on time, y'all? Oh, yes, ma'am.
Just a second.
A couple years ago, I had a saliva gland removed because I had a stone in my saliva gland, and how to prevent if I will have it again in the different part, because we have two saliva glands, how to prevent not to remove it again, and what to do right now if I have a very bad dryness in my mouth.
Obviously, you're in the weight that you need a half a gallon of water a day. What kind of work do you do? Good. That's the most important job. Do you do a lot of exercise activity? Okay. So it takes 4 water bottles to run your body just sitting on the couch. And if you're a stay-at-home mom, you do not sit on the couch. So you need at least 5 to 6 of these a day. If you're out working in the garden, exercising, you need at least 6. So first of all, make sure you have plenty of the hydration. The question is the saliva glands. What's going on in your saliva glands? I don't have an answer to that one. Do you have an answer to that one? Why the saliva glands? I don't know. I'd have to do some research on that.
That I had a stone in my saliva gland. I didn't even know that something like this exists. I thought you only had a stone in the liver or kidney.
Yeah, right.
And it's similar to when you get kidney stones and gallbladder stones. It has to do a little bit with the diet.
Yeah, lifestyle.
Actually, a little more with the diet and hydration.
Do you have a whole food plant-based diet?
And
Try
you
that
need
one.
to hydrate.
Yeah. Make sure you're drinking plenty of water. Make sure you have good water, maybe dehydrated water. I mean, not dehydrated water.
Yes.
That ain't going to work. Distilled water. Distilled water might work a little bit better for you.
And sometimes fruits, very high, very rich in water. Cucumber,
Yeah, your foods that are
Pineapple,
high in
watermelon.
That's very good.
yes.
But if you will go to a whole food plant-based diet, this is the cool thing. How old are your children? 2. You have 1? Okay. Do you know what makes my wife the happiest? When she's with her grandkids. I mean, she loves her 5 grandkids. You think you love your kids? Grandkids are just amazing. I mean, I love my kids. I really do. But grandkids are so much fun. If you want to live longer and enjoy those grandkids, Cornell University and Cambridge University found that if you'll do a whole food plant-based diet with variety, on average, you'll live 15 years longer, that you can enjoy those grandkids and great-grandkids. And that's worth it right there. That is worth it right there for a mom. I mean, if Mary Lou could never be at the store and be with grandkids, and she's probably listening right now. She'd clap, say yes. She's with my grandkid right now, 2 of my grandkids right now. So it's worth it just for that, not to mention for your health. I would definitely look at a whole food plant-based diet with variety. You'll get so many benefits. You really will. And make sure you have plenty of hydration. Really important. Okay, anything else? How are we doing
Yes.
time-wise? Okay, last question.
So-
I'll tell you, one of my anxieties is being late to an airplane, so I'm going to keep watching that time. I don't want to
All
miss
right,
that. I like y'all, but I
it'll
need
be
to be
quick.
home tonight.
All right, so you mentioned a herb that
Yes.
is like antidepressive or something. So I have a friend that has depression, and like I've always thought of depression as something incurable. That you just gotta. So like,
What do you do?
What's your stand?
I had this lady that had significant depression. She was up higher than us in the U.S., and she was from Michigan. And she had major, major depression. She came down and stayed with us for a while with her sister, and we worked with her. I mean, she had some significantly challenging issues. And here's what we found. Number one is water. Number one's water. No, number one's prayer. Ask God to tell you what to do and ask God to bless. It's huge. But water's number one. Dr. Strachan found that a gallon of water a day, even at your size, a gallon of water a day for depression is significantly important. And then I found the skullcap tea that I talked about over here, SCULLCAP, skullcap. Skullcap is also very good. And make a quart of it. You can drink as thick as you can make it thick. I do at least a cup of the herb in a quart of water, and they drink that. B-complex. Lithium is amazing. Lithium orotate. I had a guy who's significantly depressed, has challenges. He was suicidal. And he came to me, and I encouraged him to take the B-complex, the lithium. And he went back to his doctor. And his doctor said, no way, your lithium's fine. He said, I'll show you. And he tested it. It was bad. So it took lithium, getting that lithium back up to where it belonged, and it makes a difference. He will call me now, and Mary Lou knows if this guy ever calls me to get me, no matter what I'm doing, because he can't remember what he needs to do. All he knows is he needs to call me. He gets significantly depressed, and he could kill himself. And so I'll talk to him. How you doing? Yeah, not good. Have you taken your lithium orotate? Oh, I knew you'd know what to do. No, I haven't. And that's all we need. Hangs up, takes his lithium orotate, and boom, he's back up again. Exercise is phenomenal for depression. With depression, you start going down like this. Go out there and exercise. It gets that oxygen to the brain, and depression is a brain thing. So stop anything that harms the brain, like alcohol, sleep deprivation, drugs, anything that may hurt the brain. And then give it what it needs. Give the brain the nutrition, the whole food plant-based diet with variety, the adequate water, that gallon of water at least. If he's a big guy, how much does he weigh? Oh, she? She's not real big. Oh, gallon of water. Gallon of water. Exercise, and exercise 4 times a day for at least 20 minutes. Really important for depression. Get out there. Nature, the blue sky, the green grass. I know it's the wintertime, but out there and seeing the birds and the squirrels and all that's really important for healing the brain. Make sure, another thing for depression is going to sleep by 9 o'clock. They did a study on women, and they found that women who went to bed, instead of 11, go to bed by 9, 100% of them had significant improvement in depression by just moving them to go to sleep at 9 o'clock at night. And another one is music. You want calming music. The best music for depression is elevator music, classical music. Have it kind of upbeat to get going in the day. Have a nice classical music during the day, and then a slow down classical music at night. Significant for depression. What else was there? I had another one I was going to mention. Also, depression, there's flags. There's things that cause depression. It can be finances, it can be school, it can be taking care of your grandchildren or great-grandchildren. I mean, a lot of things can where I've got a lady who, she takes care of her great-grandchildren because her children and her grandchildren are in jail for drugs. They're drug dealers. And so she's having to raise her great-grandchildren. We weren't made to raise our great-grandchildren. We're made for them to take care of us. And so those things can cause, it can be a flag. It can be drugs that she's on, medication. So you want to find what that flag is. Also, sunshine. You can, as we get more north, it's harder, and so the person can have SAD, seasonal affective disorder. And so you can buy a light. It's called a full spectrum light, And that can help to convert the tryptophan from the flaxseed, 3 tablespoons of flaxseed twice a day, grind it, and eat it within 15 minutes. That tryptophan in 3 tablespoons ground twice a day have a lot of tryptophan. As she has that light from that full spectrum light, it stimulates the pineal gland to convert it into serotonin. Someone with depression needs serotonin. So there's a lot of things you can do there that can help her out. So there is hope. You can get rid of depression. There's another one. Read a chapter in Proverbs every day. It's huge. The Bible is just so rich it's a medicine itself. And pray and ask God for help. That's her biggest thing.
If I may say just one thing, I just wanted to thank you very much. You're going to be thanked by Anna, but I receive a number of thank you from people all around the world. I'm just going to read one from Malibu, California. It says, I love this kind of health stuff, so important. Thank you so much. I'm going to read also one that we received from Kenya. Today, I'm blessed by Walt Cross Health Series on Cancer on Old Mountain Remedies. May God bless the Elmcourt Church for her good work. So there are people who are watching all over the place, and they are thankful for this seminar.
God
and
is
I'm
good.
praising God,
That's
and
right.
I'm so thankful that
God
you
is
thank
good.
you.
Let's give a round of applause for Walt. Thank you, everybody, for being here. Walt, I'll let you start packing up your things. You got a plane to catch. For everyone else, again, thank you so much for...
If anybody wanted those...
Yes, if anybody's interested, you can come up and see Walt before he heads out. He's doing all these lectures for free, as you may know. So if you feel called to help his ministry, so he continues to travel and continues to do these lectures, we have a box at the end where you could drop some money. So we have some future lectures coming up, actually. Next weekend is our last lecture. We're going to have Dr. Eddie Ramirez with us for 4 different lectures. And Dr. Eddie Ramirez, he is a medical doctor. He's also a scientist and researcher. And he's published over 130 different medical papers. He's also a co-author of Rethink Food. You may have heard of that book with Dr. Greger and Hans Diel and a lot of other physicians. And so he's going to have 4 different lectures. The first one is on Friday, The New Emerging Diseases, December 18th at 6:30. Healing Your Life by Healing Your Thoughts on Saturday morning at 11. And then Saturday afternoon, The Best Weapon Against COVID and How to Sharpen It. That will be at 2 o'clock. And then Saturday at 3 is going to be How Your Microbiota Influences Your Emotions. So he'll touch on the mental health connection with the gut. So if you're interested, please RSVP on our meetup group. It's meetup.com/ElmhurstSDA. And last but not least, we have some books in the end if you're interested to pick up some free literature. And thank you so much for being here again, for everyone who showed up, who watched online. We are really grateful, and we'll see you soon.